This is a demonstration of Allscripts Professional EHR for Pediatrics. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In pediatric practices, most providers are challenged with immunization management, quick and easy access to labs and procedure results, triage of messages for sick patients, well child visits, and plotting growth chart points accurately. Allscripts Professional EHR can help make your life a lot easier with an immunization module for quick viewing and printing, result notifications, messaging, well child visits with bright futures and Denver developmental guidelines, and automatic plotting of growth chart points. Now let's take a look at how Allscripts Professional EHR can help meet your needs. You're logged in as Cindy Pope, who is the nurse for today's visit. Cindy is viewing the schedule for the patients that are set to come in today. Here are all those patients and why they're coming in, the time of their appointment, when they checked in, and when they checked out. The names in black indicate the patient has not checked in yet. The blue means the patient has checked in and is sitting in the waiting room. The green indicates the patient has checked in and the chart has been started by the nurse, and the red indicates the patient has checked out. Your patient, Dennis Dodd, is here for his well child visit, so your nurse will select the well child visit template and document his visit. As soon as she selects Dennis's chart, you'll notice that it's telling her the patient is due for some immunizations. These are the patient's immunization records. She can see exactly where he stands and what immunizations are due next. The 4-year well child visit is selected, and now she'll enter the patient's vital signs, which will automatically plot on the patient's growth chart. You'll go ahead and update the patient's vitals and pull in his previous weight. He's gained a little bit of weight. He's at 45 pounds now, 42 inches tall, and you'll add his blood pressure, pulse, etc. Once that information has been added to the record, you'll notice that it does trend and it also calculates his BMI based on his height and weight, which is a meaningful use requirement. The growth chart shows the plotting automatically using his weight against his years. This can be printed and handed to the parent immediately. Next, the nurse will document the reason for the visit. He's here for his 4-year well child visit. Select that, and you'll begin to document using the template. He's here with his mother. She works outside the home. The patient's general health is good. He has a normal healthy diet, but she does let him eat junk food sometimes. You'll say she lets him eat hamburgers, sodas, and candy. So as you make your selections using the template, it creates the note at the bottom of the screen. If there's anything else that your nurse wants to document, she certainly can do that. The parent could have filled this information out in the waiting room, and it would have been automatically populated to the chart. He does sit on a potty chair. The nurse has collected the information from the parent and moves on to the history for the patient. You'll bring in the patient's current problem history. By selecting Include Active, it drops down the patient's up-to-date history. If you notice at the very bottom of the list here, it shows everything that's been previously documented. Now you can just review this with the parent. The patient is allergic to peanuts. Mom noticed that her son had some peanuts the other day and he had an allergic reaction to them. He started coughing. So you're going to select an allergy to peanuts from your pick list and document that. If he's been prescribed any medications from any other provider, that information will be stored in the fill history. The fill history is based on the pharmacy and the insurance company that filled the script. Therefore, you can go in as the nurse, find the history for this patient's meds list, and pull it right into the chart. You can drop the patient's current medications into the record as well. If there's any other documentation necessary, this can certainly collect that. So now you have an up-to-date allergy list and a medications list here. You'll document that it's been reconciled. His family history and his problem list have all been updated. You just met meaningful use by updating those items with those simple clicks. The review of systems will show this patient's current well child visit. By selecting Apply, it pulls in the standard template for a review of systems for a well child visit. If his mother indicates he has difficulty breathing or he's complaining of an ear infection, she can make those changes right away by selecting it here. This is what the note looks like so far, and now she'll send the chart over to the doctor, indicating which room she put the patient in. He's in room Tiger 2, and Mom is tired of waiting. Cindy put a sticky note on the chart to alert the provider of exactly what's going on with the patient as well as the parent. Now you're logged in as Dr. Childs. He sees the same schedule as the nurse. However, over to the right in his queues or his inbox, there's all the work that he has to do as the day goes on. Received charts shows where the patients are roomed. So, there's Dennis Dodd in room Tiger 2. Select the chart. Here's the sticky note that the nurse added explaining that the mother is tired of waiting. Once he selects that, he gets the message that immunizations are due for the patient as well. The face sheet shows everything that is pertinent to this patient, such as his problem list, past medical history, allergies, social history, etc. The patient's encounters, including new visits, scanned charts, his current meds list, and any orders. If the doctor wants to review any notes from the past, he just selects the date of service that he wants to see. Now the doctor's going to finish talking to the parent and see if there are any other concerns. He selects the complaint. Again, he can run through this list here, see if there are any developments or concerns or any complaints. The parent says no. She's happy with how he's doing. Are there any nutritional concerns? She says, yes, he eats a little bit of junk food. You can add junk food here. Again, as you add to what was already entered in by the nurse or the parent, it just drops into the note right here. His sleep schedule. He's doing pretty well. He sleeps for maybe 9 hours a night, and he still sleeps with his parents. So you've updated the complaint, and now you move forward to the physical exam. Here's your 4-year well-child physical exam. You're going to pull in the normal visit because this patient is relatively healthy. There are no changes. The developmental milestones automatically pull in. If there's anything you want to change, you can certainly get a full list here and then make the changes as necessary. His speech is understandable. He knows 3 adjectives, etc. You can add to that if needed. Finally, the assessment and plan. Under the assessment and plan, you'll notice there's your well-child visit already listed. You're going to select this well-child visit. It pulls in the ICD-9 code for billing purposes, and if there's anything else you want to give the parent, such as an education sheet on a 4-year-old's healthy diet, that will be listed here. You want him to come back in a year, and then you want to also give him a DTaP today. The immunizations are going to pull in along with the typical protocol. These can be set up by each provider, and they can be set up by diagnosis or by well visits. So all this information is pulling in for you. The full note is available and ready to be signed and billed. Once the nurse sees the order, she can very quickly go in and document the visit for immunizations. Once the nurse sees the immunization order, she can document that she gave that immunization. There's the education sheet that she's going to give for the DTaP, and it also pulls in anything else for that patient as far as the DTaP is concerned. You'll save and complete that, and now it's been updated to the immunization chart. Now you're ready to sign off on that visit. The super bill is displayed here with the CPT billing code, the ICD-9 codes, and the billing for the immunization. An education sheet can be generated at the end of the visit and provided to the parent, as well as the clinical summary, which is a meaningful use requirement. This means that at the end of every visit, you must generate a clinical summary to the parent regarding the visit for today. You select OK, and that will generate both of those items for you. Education sheets are already a part of Allscripts Professional EHR. There's the healthy diet sheet, and then here's the clinical summary. It pulls the information from the visit and places it into the clinical summary, which is generated for the parent. Once the doctor signs off on the chart, it is immediately filed away back into the patient's record. Messaging. When a parent calls in regarding their sick child, a message is generated and sent to the doctor's inbox or to the nurse. That message will display in their queue. Dennis now has vomiting and diarrhea. This message came over from the nurse for the provider to review. The doctor can very quickly pull the chart for this patient, look at his face sheet, see when his last visit was, and see exactly what was done during that visit. You reply to the nurse to have her call the parent to make an appointment. Now that's going back to Cindy, and it is attached to the patient's chart at the same time. It is now removed from the doctor's inbox. Any kind of procedures or result notifications are also indicated here in the result notifications. Any lab work that's due or any procedure results that you need to see are indicated here. This flows right back into the provider's inbox. Select the result of the patient that you want to see and it gives the results here. The doctor can review and sign off on those results immediately, make a notation, send a message to the nurse, and also annotate on that note if necessary. That has been signed off, and now the doctor is back to his message queue. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts practice management solution seamlessly. The Allscripts referral network, to patients through the patient portal, to patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.